Welcome. This is Dr. M of ThisIsDrM.com, the website and all the social media platforms. This is Dr. M, TikTok, LinkedIn, Facebook, Instagram, and the YouTube channel where you can find longer form, more comprehensive videos that teach you how to transform, treat, and heal yourself if you're here as someone seeking your own healing, or how to more effectively, comprehensively, and compassionately treat your patients if you're here as a natural medicine practitioner. Now, this video has been curated in particular for you as a seeker of greater information, either again, to improve the quality of your own life in recovery from developmental traumas and addictions, or to be a more effective practitioner in the offering of your services. Now, regardless of your reason for being here, thank you. I'm so glad you decided to do this. And I encourage you, if you find insight and information that is useful and helpful to you in your life, to share this video with your friends, family, colleagues, your professional network, anyone you think might benefit from having this level of information and this level of insight. Because you are in the center of your own life, the primary catalyst of change for your own well-being and healing, and the potential spark for the awakening of consciousness in the lives of the people with whom you interact on a daily or one time and never again basis. So please do share this video if you find value in it yourself. So this video is titled BACKSHUPOINTS, Basics and Applications. And the basics part means that while you will receive a comprehensive treatment of the subject of BACKSHUPOINTS, this really is the very beginning. It's an elementary introduction, somewhat of a tasting. You can think of it as a tasting of Chinese medicine. It'll give you a good, again, comprehensive glimpse into the vast world of understanding in Chinese medicine, and it is the basics. So if there's more information that you would like to call to you, by all means, follow any of the social media platforms I just mentioned: TikTok, Facebook, LinkedIn, Instagram, YouTube, and the website, ThisIsDrM.com. Message me personally. I love having conversations about this work, and have conversations with your natural medicine practitioner. Seek out a natural medicine practitioner if you don't have one. And if you are one, discuss this with your colleagues, particularly if you're not a Chinese medicine practitioner, because you'll start to find that there are corollaries in the work that you do. I can almost guarantee it without actually knowing you personally, that you're going to find corollaries, because the natural medicines and all the truths, all of the universal truths, are speaking and coming from the same source. So you will find comparisons and corollaries in other forms of natural medicine as you digest this material. And before we get into the digesting of the material, I encourage you to take your time with it. Because what you will find likely, which is what I found when I was a graduate and doctoral student of Chinese medicine, is that you really are learning a new language. Aside from the actual words themselves, it is your mind that has to transform and expand and be shaped by a different concept, a different perspective on life, on living, on a human being, on health, on the function of the body, how the organs function, and how the organs are related to each other. The fact that they are even related to one another, because probably like me watching this, you were steeped in the Western traditions, which are very much geared toward compartmentalization and individuation of systems one from the other. However, and quantum physics bears this out, it really actually is all connected. So you're going to hear me speak about relationships between the organs that may sound completely new and foreign to you. If it's new, allow your mind to expand, allow your consciousness to expand, allow your imagination to expand. and consider a new way of relating to yourself and the people with whom you work, the people with whom you share your life, based on the information you're about to receive. Lastly, in keeping with the theme of the information that you're about to receive, continue to take your time, take breaks if you need to, pause the video, go away for an hour, go away for a week, walk around with the idea, contemplate things, look for the information in the lives around you, look for the truth of the information in your own body. We're going to be talking about points along the spine, and that's what the back shu points are. I'll get into that in more depth as soon as I show you the slide of the back shu points. But we're going to get into points along the spine. And in particular, if you're a physiological practitioner as opposed to a psycho-emotional or mental health practitioner, you've likely worked with pain syndromes to some degree or the other, and back pain almost invariably, because back pain remains the #1 reason statistically that people seek medical intervention. People go to the doctor because they have back pain. That's the #1 reason people go to the doctor. It's for pain and back pain. Back pain is the spine. So we're going to look at the spine and we're going to learn a new way of understanding back pain that starts to reveal the content of the life narrative, the person's story, their karma, if you will, that will give you and the person with whom you're working, or if you're here for yourself, that will give you hopefully a deeper understanding and a clearer understanding of why you have chronic issues, why things hurt, why you'll go and see your chiropractor, your acupuncturist, your Pilates instructor, your massage therapist, your Rolfer, your Feldenkrais practitioner. Clearly, I could go on and on. You go see your natural medicine practitioner for the same thing year after year. Why is it not going away? There's a story there. Your body is giving you information about your life narrative. Or if you're here as a clinician, the body of the patient in front of you is giving you information about their life narrative. We're never just working on the physical or the physiological in Chinese medicine. Not ever. Once again, I said earlier, quantum bears it out. It is all connected. So whenever we're looking at the physiological, we are reading information about what's taking place internally that's giving us information about how the life narrative is unfolding, or how the life narrative needs help and support in removing some blockages, removing some stones from the path, creating space for things or chi to flow so the life narrative can continue to unfold toward what Chinese medicine refers to as the destiny of the person in question. So get comfortable, get ready to learn a new language, expand your imagination, make sure you have something with which to take notes available to you, and take your time. We'll do this together. And hopefully you'll learn a great deal that adds value to your life in your own incarnation. So let us go to the slide. Now, it may seem overwhelming at first when we look at all of these lines and all of these spinal levels. If you're not familiar with the spinal levels, don't worry about it. I'm about to talk you through it. First, however, let's just have a guided museum docents tour of the slide itself so you can start to quiet your mind and not feel like you have to read everything all at once. So we're working with the back shu points. Word back is obvious, points is obvious, shu perhaps not so much. Shu is a Mandarin word that means transporting. Now, the back shu points are known as transporting points. What are they transporting? Well, simply put, in Chinese medicine, everything is qi. Everything can be relegated to the realm of qi. In the same way that we understand in Western constructs that every solid and gaseous and liquid phenomena we witness is composed of the same protons, neutrons, and electrons as everything else on the planet. So everything in Chinese medicine is described as qi. And qi is then broken down into yin and yang. All three of those words you're probably quite familiar with. But what's being transported in the backshu points is qi. Where is it being transported? To the individual organ or organ system to which each point correlates. Now, before I go any deeper into that, let's return to the museum docents tour. On your left side of the slide, you'll see spine-anatomy relationship. And going from C1, the first cervical vertebra, all the way down to the bottom of the list, the coccyx, you'll see every spinal level and the organ system or the organs or single organ or gland or nerve that it innervates. These are considered nerve roots that supply the associated body part, the listed body part to the left of the spinal level with the system that it innervates or supplies with electricity. The nervous system, the nervous signals that make organs run, makes the diaphragm function automatically, makes it able for you to wiggle your big toe or wiggle your ears or blink your eyes. These are all byproducts of electrical signals. The nervous system is an internal electrical system, like a house has internal wiring. That's your nervous system. So at each spinal level here, from the base of the skull, C1, the first cervical vertebra, through all 7 cervical vertebrae, through all 12 cervical thoracic vertebra, and all 5 lumbar vertebra, into the sacrum and the coccyx. The sacrum is the triangular bone that turns into your tailbone. The tailbone is the coccyx. You will find at every level a nerve root that sends an electrical signal out and receives electrical signals and communication and information from the associated organ listed on the left. Let's pause to breathe for a moment. You may need a second to digest that. And on the right side of the slide, you'll see a diagram of 5 circles, 5 differently colored circles with associatedly colored arrows pointing in different directions. This diagram explains what is called the generation and control mechanism of qi. Qi flows in specific directions. And within each circle, the label within each circle, you will see an element listed: fire, earth, metal, water, and wood. These are the 5 primary elements of Chinese medicine. If you go clockwise around the circle, these are how each of the elements give rise to the one after it. And if you follow the diagonal arrows within the circle, you will see which element controls or sedates or quiets or soothes the element in the direction of which its associated arrow is pointing. For example, really simple, clear, easy one. In the lower left-hand corner of the circle, you will see a blue circle that says water. There is a diagonally upward pointing blue arrow that goes to the red circle, which says fire. Water controls fire. In that way, that's probably the easiest one to understand as far as the control cycles are concerned. If you are looking to learn more about Chinese medicine, please feel welcome, because again, this is a basics treatment. Please feel welcome to go to my website, ThisIsDrM.com. Go to all of the social media platforms, particularly the YouTube channel, This is Dr. M, where you will find longer form videos that will explain all of these concepts in a way that is more comprehensive than this basics and applications video can get into. So finishing off with the museum docents tour, you'll see a list on the right-hand side underneath the diagram with the generation and control cycles of something that says BL11, BL12, BL13. The BL refers to the urinary bladder channel. You're likely, I would imagine, if you've come to this channel, have some level of familiarity with Chinese medicine. And every channel or meridian in Chinese medicine is named after its associated organ. There are 12 primary meridians in Chinese medicine. And without going into all of them, again, I have videos that go into greater depth if you're looking to learn more. This diagram focuses on the urinary bladder channel. That's where the back shu points are to be found. Now, the back shu points begin at spinal level T1. So if you look at the left-hand side again, in the thoracic segment of the diagram, and you see T1, that is thoracic vertebra 1. And then hop over to the right-hand side of the diagram, you'll see that T1 is associated with bladder 11, or UB, urinary bladder 11. Now, don't get too caught up in memorizing the spinal levels and even memorizing the names and the numbers of the points, because you will have this video and you will have the slide as a reference henceforth. This is yours now to keep and refer to. But let's digest this. This is more important to bring into your understanding at this stage. Each point on the urinary bladder channel from UB11 or bladder 11 to UB30 or bladder 30 goes directly to the organ with which it is associated. And as far as location is concerned, and diagnosing, and I use the word diagnosing in a very broad sense, in diagnosing the information that each of the point levels discloses, you can start to ask yourself and the person with whom you're working what the pain or the knot or the stabbing, sharp feeling, or the fasciculation, the fluttering of a muscle, or the dead zone, or the lack of sensation, or the softness of the tissue there, or the herniation, or the bulging disc, or the nerve root compression, or the stenosis, or the scoliosis means at that level, or how a car impact, how a car accident, how a fall has impacted you or the person in question on the physiological level as far as internal medicine is concerned, and on the psycho-emotional level according to the emotional assignation of each organ. What do I mean when I refer to the emotional assignation of each organ? Here's another layer of Chinese medicine 101. Every organ, from the perspective of Chinese medicine, which again remind you is a thousands-year-old system of treating the body both physiologically and psycho-spiritually. So the fact that the medicine is itself thousands of years old is testament to its veracity, testament to its claims. In other words, it actually works. There are legitimate corollaries and real recovery, relief, and disease treatment and cure that takes place within the realm of Chinese medicine. So while what I'm about to say, this is the part of allowing your imagination to expand, to which I was referring earlier. So while it may sound implausible or it may be unfathomable for you at this point to digest this information, just start to let it marinate within you. It took me a couple of years of sitting in many classrooms in graduate school, a 4-year master's program, to start to understand and see the corollaries in myself and in the people with whom I shared classroom time, the people I started treating as an intern in the clinic. So if this is your first introduction to this information, just let it wash through you. Let it pass over you. This may be where you want to take a break and just walk around with things for a while. So going into now the emotional assignations of each organ system. This is where I'll give you some more detail that you may want to write down. So again, I hope you did grab that note-taking implement or note-taking tool that I asked you to grab in the beginning of the video. Let's start with the first organ in the list. At bladder 13 or UB13 is the lung. Every organ in Chinese medicine has associated with it not just its physiological function, but a psychodynamic function, a season, a color, and a taste, and an element. So the emotion associated with the lung, there are two, in fact. There's the yin emotion and the yang emotion. Remember, everything comes from qi, everything is qi, and then begins to break down accordingly. The first division or the first compartmentalization or distinction from source qi, or the source that is qi, is yin and yang. The yin emotion of the lung is grief. The lung holds the space of grief. You can think about crying and sobbing and how heavy the chest feels with grief. The yang emotion, or the bright, sharper, quicker, lighter emotion, more fiery, if you will, is integrity. The lung holds the space of grief and integrity. So if you're working with someone who has COPD, someone who has scoliosis, which will affect the shape and the function of the lungs in the rib cage and the thoracic cage as the person grows and develops. If you're working with someone who has had a loss, or who's working with chronic illness of their own, or who's a caretaker for someone who has chronic illness, who's experienced a death in their family, you may find that points, sensitive points, tender points, develop around T3, where you will find UB13 or bladder 13. Now, I just mentioned something that reminds me to speak more specifically on point location. When you are in Chinese medicine school learning point location, you learn a lot of point location for a very long time. Professors are very specific with point location, and Chinese medicine is itself very specific. What you find after time, however, being out in practice and working with individual people who are not made in factories, but who are all genuinely unique creations in and of themselves, is that the points aren't often exactly where the book says, but they may be in the neighborhood. And that being said, I'm going to tell you where this line of points is, so you can start to nail down or become more specific and more conversant in what you're assessing on the back bodies of the people with whom you work, or on your own back body. So at the third thoracic level, at the level of the third thoracic vertebra, about halfway between the posterior spinous processes, so the dots, if you run your finger along someone's spine and you feel those bony, bumpy bits, those are bones, but those are the posterior spinous processes of each vertebra. They're like the dorsal fin on a shark. You can think of them that way if anatomy is new to you. But at that level of T3, halfway between the posterior spinous process, or the shark fin of T3, and the medial border of the scapula, or the inside vertical line of the shoulder blade. If you look on the slide, you'll see a triangular bone on either side of the spine. That's the shoulder blade. Close to the shoulder, you'll find the shoulder blade. Those bilaterally, triangularly shaped bones each have a vertical border that's close to the spine, halfway between the posterior spinous processes and that medial vertical border of the scapula. Is about where you will find UB13 at the level of T3, halfway between the posterior spinous processes and the medial border of the scapula. Now, if you take that medial border of the scapula, that vertical line of the triangularly shaped bone, and you draw an imaginary line all the way down the spine, that'll give you a frame of reference for where you will find the other back shu points that are inferior to the scapula or below the scapula. So going back to the lung, which is where we just left off, at the level of T3, about halfway between the posterior spinous processes and the medial border of the scapula, you'll find UB13, which if it's painful, if it's tender, if it's particularly tender, more so than anything else around it, may be an indication that there is a grief component, there's a loss component, or there's disruption of integrity in the life of the person. What does that mean? Or in your life, what does that mean? Not being your fullest self, selling yourself short, underselling yourself, abandoning yourself. I specialize in the treatment of developmental traumas, particularly incest traumas, eating disorders, and addictions. And what takes place most commonly, invariably, in response to the level of abject shame that is one of the fundamental features of incest trauma, abandonment trauma, eating disorders, and addictions, is a violation of self, an abandonment of self, a gaslighting of self, a diminishment of self that undoubtedly is guaranteed to corrupt your integrity. You're unable to be your fullest, most authentic self because you've developed a practice of being less than yourself in order to protect yourself from the unspeakable. So that is what a lack of integrity can look like in a survivor, in a patient, in yourself. It's not living into the fullness of who you are, having a dream and somehow not being able to realize it. Those are the blocks. That's the lung at level T3, thoracic vertebra 3. That's UB13, halfway between the posterior spinous process and the medial border of the scapula at T3. So that's the foundation for understanding how these back shoe points work. You can treat the lung directly, you can treat the physiological function of the organ, and you can treat the psycho-emotional or psycho-spiritual function of the organ. And you don't have to be an acupuncturist to do it, obviously. This information is available to all, and this information was clear before the development of actual acupuncture needles. These were observations that were made about the physiological and metaphysical function of human beings, like an understanding of the human condition, long before an actual needle came along to pierce the point and communicate more specifically and more succinctly with the chi of the person in question. So now that we have that foundation laid for how to decipher and understand the back shoe points and what they do for us and how they can be diagnostic tools when assessing and diagnosing either ourselves or with whom we're working, let's go now through the rest of the points with a little more expeditiousness. Again, you may need to pause, walk away for a minute, come back. You may need to pause just to take notes. You may need to rewind. Do anything you need to do to make this an easy process, a pleasurable process, easy information to digest. We'll move now to the pericardium directly below the lung. Now here's where we get into an interesting discussion in the next two organs, the pericardium and the heart. In Western medicine, the pericardium is not recognized as an organ. It's simply recognized as a protective sac around the heart itself. In Chinese medicine, it's recognized as an organ. And the pericardium is a unique organ in that it doesn't have has the sanjiao. It has the sanjiao with which it is paired, but the sanjiao is not an organ in and of itself in the way that other organs are recognized as actual physical entities. Again, I probably just dropped something in your lap that made you go, Go to the YouTube channel, please. I invite you to go to the YouTube channel to find more videos or send me a message and we'll have a conversation about it. But the pericardium itself protects the heart. And the pericardium point is found halfway between the spine and the medial border of the scapula at the level of T4. The lung is at T3, UB13. T4, UB14 is where you will find the pericardium. The pericardium, as the protector of the heart, reflects where we do and do not have clear, solid boundaries, Pulse diagnosis is one of the primary features of diagnosis in Chinese medicine. It's one of the primary forms of diagnosis of Chinese medicine. And I find overwhelmingly in my patients in general, but women in particular, that the pericardium pulse is in great deficit, indicating that there are not enough healthy boundaries, or there has been a dissolution of healthy boundaries that leaves the heart vulnerable, and it makes it difficult again for one to live from one's most authentic self, to speak authentically from the heart, to say yes when you mean yes, and I find far more importantly, to be able to say no when you mean no. These are healthy boundaries. Working with pain points at the pericardium back shoe point can create the environment in which a patient, if you're the patient or if you're working with patients, can begin to establish healthy boundaries for themselves. Let's go now to the heart. The heart can be found at T5, thoracic vertebra 5. It is urinary bladder point 15. Setting aside the physiological functions of the heart, which most of us know quite well, and focusing more on what you may not know as well as the metaphysical and psycho-emotional functions of the heart. It's yin and yang emotions. The heart governs the emotions of sorrow, yin, and joy, yang. Quite simply, joy and sorrow. I'm going to keep us moving. The next organ to which we will drop down is at thoracic level 9. You'll see T9 there on the left-hand side. And on the right-hand side, you'll see point UB18, bladder 18. That is the back shoe point for the liver. So physiologically speaking, you can work with or treat, or you may find tenderness at T9, UB18, halfway between the posterior spinous process and that imaginary vertical line that you've drawn down from the medial border of the scapula. If you're working with someone who has a diagnosis of alcoholism or liver cirrhosis or fatty liver disease or repressed anger, because the liver governs anger. It is said in Chinese medicine that the liver governs all qi and all emotions of body, but primarily the liver is associated with anger and frustration that becomes anger. That's its yang emotion. Its yin emotion is depression. When anger is suppressed and repressed, it becomes liver depression. So this is where, and you'll see that T9 is also the spinal level that innervates the adrenals and receives information from the adrenals. This is where you will find patients, if you're a natural medicine practitioner watching this video, or you will find within yourself or your friends and family members if you start testing out this information on the people in your day-to-day life, people who speak of tightness in the mid back. Oh my gosh, my mid back is always tight. And you'll do the stretching and they'll do the abdominal work on the opposite side of the body, and they'll get the massages and they'll go to the chiropractor, they'll go to the acupuncturist, they'll go to the osteopath. They're doing all the things. When you see chronic conditions, and remember, back shoe points are designed to treat specifically chronic conditions. So when you see these chronicity of complaints, start to investigate what's taking place on the psycho-emotional level. And when you have this mid-back tightness that has been chronic in yourself or the person with whom you're working, ask the question, what's the role of anger? What's the role of frustration? What's the role of manifestation and realization of self and one's goals that is or is not the story in this person's narrative? Because the adrenals and the kidneys, on which the adrenals sit, more the kidneys as far as Chinese medicine organ theory is concerned, but also in the area of the liver, because the liver is designed to promote, the liver likes the smooth flow of qi. The liver likes things to be smooth and easy. I was saying that earlier, every organ has an associated color, a season, a taste, an emotion, an element. It also has an associated direction. The liver's direction is spread out and smooth. The liver likes to be chill. Liver likes to be very chill. When it's not chill, when things don't go its way, when plans don't go as intended, there's frustration. And when frustration mounts, there's anger. When there's continual chronic anger, the surface of the body starts to reflect what's taking place internally at the organ level and at the mind level. That is where you can see chronic tightness in the mid-back, tightness that's not relieved by stretching, tightness that's not relieved by doing all of the breathing exercises. Instead, that's when you're going to want to start to investigate questions that relate to the psycho-emotional level of the person with whom you're working. Same thing holds true for the gallbladder, the paired organ with the liver. This is the first time we see paired organ systems right next to one another in the back shoe points. The liver and the gallbladder are paired organ systems. The gallbladder chiefly primarily governs decision making. And you'll see that expressed in the gallbladder channel. If you Google gallbladder channel points, you'll see that the gallbladder channel starts at the corner of the eye and zigzags across the head, zigzags down the side of the body, zigzags down the side of the lower leg. The expression of the gallbladder channel is one's ability to be able to make decisions, to be able to consider both sides of a story. And when you're not able to consider both sides of a story or a decision easily or subject easily, frustration can result, and then the liver becomes agitated. And again, you find this tightness in the mid-back. Let's move down to the next level, the spleen and the stomach. This is the next adjacent paired organ system that we will find. The back shoe points of the spleen and stomach, located at T11 and T12, thoracic vertebra 11 and thoracic vertebra 12, also understood as UB or bladder 20 and 21, govern, as one might guess, the digestion of food, the processing of material, but not just the processing of alimentary material, food, nutrition, but the processing of life experience itself. How do you relate to your environment? How do you process information? Do you have executive functioning deficits? Are you highly adept at executive functioning? Are you a worrier? The yin emotion of the spleen and stomach is worry. Worry is chiefly assigned to the spleen. And worry correlates to the spleen. You can remember worry associated with the spleen by thinking of a ruminant animal. For example, a cow. A cow has 4 stomachs. A cow is known as a ruminant. And ruminants, animals with multiple stomachs for digesting, have different enzymes in each stomach. So if you think of yourself as a cow, kind of chewing a cud and chewing the cud and working it over and chewing it all day long and just working on that same thing and not letting it go, not swallowing it, not processing it completely. And think also of the ruminant system with multiple stomachs where things get digested and reprocessed over and over again from a different perspective. You can think about someone who is, and this will impact the gallbladder, indecisive because they're just constantly thinking about the same thing, working it over in their heads, not processing it, not making a decision about it, but just worrying about it, wringing their hands over and over again, same thing, day in and day out. That's the spleen, that's the stomach. The yin aspect of the stomach, or when the stomach and spleen are in deficit or in disease, there's an inability to process things effectively. IBS, IBD, and IBS and IBD have come to be understood almost invariably as somatic expressions of developmental traumas, not purely physiological conditions. And truth be told, if one spends enough time studying Chinese medicine, one begins to understand and recognize that any physiological presentation has an either associated or underlying, so either a related or causative relationship with a psycho-emotional presentation. In other words, and this is particularly useful and helpful, so make a note of this for yourself. In other words, We're looking at how the mind expresses itself in the body. That's what these points are telling us. At the beginning and the end of the day, we're always working with the mind. We're always working with the consciousness of the individual and with ourselves. So as we look at the emotional functions and the physiological functions of these organs, particularly in the example of IBS, IBD, and how they are expressive of the system's inability to process information and experience, nervousness, and worry. Moving down to the next layer of the back shoe points, UB22, the Sanjiao, the triple burner. San in Mandarin means three, Jiao means cauldron. And there are considered to be three cauldrons or three chambers: the upper jiao, where the heart and lung reside, the middle jiao, where you'll find the primary digestive organs, spleen, stomach, liver, gallbladder, and the lower jiao, where you will find large intestine, small intestine, kidneys, urinary bladder, or the deeper processing and excretory organs. But the Sanjiao really in contemporary times is more understood to be the endocrine system, the fluid communication matrix that conveys hormones throughout the body and connects all of the organ systems and their associated glandular functions to send and receive information for how the system is functioning and how the system ought to be functioning. That's the triple burner at UB22. UB22 is found at spinal level L1. You'll notice that on the left-hand side of the diagram, L1 innervates the large intestine. What happens when the endocrine system gets disrupted? What can happen often when the endocrine system gets disrupted? When we get overly anxious, when we get overly heated, and we have a preponderance, an overwhelm, a saturation of hormones in the system. Hormones are the chemical substance of our emotions. Hormones are the physical substance that gives us the feeling we have: joy, sorrow, grief, lack of integrity, worry, anxiety, things that have been mentioned so far. Anxiety is the first time I mentioned anxiety here. But what typically happens, you get a nervous stomach and you can have loose stool accompanying an overwhelm and a preponderance of emotion. So you may start to see now how the system of Chinese medicine and its associations very clearly explain what takes place at the psycho-emotional level of the human condition and how the mind expresses itself in the physical self. Let's go now to the kidneys, UB23 at L2. The kidneys, one of my favorite organs. The kidneys, related also to the urinary bladder, that's an obvious connection, hold the life essence. I was talking before about the liver and plans being executed, and the liver back shoe point located at T9, the innervation point for the adrenals and moving oneself through life. I mentioned the kidneys back when I was talking about the liver. You may want to rewind and just get a little refresher on that if you don't recall. But it's the kidneys themselves that hold the life energy, hold the Jing. It's called Jing. This is the potential for fullness of life and life expression, life expressing itself as you, through you, with which you enter into the world. When you are conceived, when each of us is conceived, there's a certain amount, not finite, but there is an amount of Jing, of life potency, with which you are conceived. And this is what expresses itself as the essence of who you are. People who are identified as being old souls, or asking a parent, I see this on social media all the time, these videos. How did you know to put him in drum lessons? And you'll see somebody's child playing drums. There's actually a social media video about this. There's a social media video about everything. You'll see someone's child playing drums at age 3 and being 3 years old on the drums, and then cut to them at 5 and they're quite proficient. Cut to them at 7 and they are amazing. Cut to them at 15 and they're extraordinarily off the charts. This child came into the world with the Jing, the life essence, the life force of a drummer, of a musician. Seen similar videos about dance class. How did you know to put her in ballet? Seeing toddler videos at age 2 and cut to contemporary times when she's a principal ballerina for one of the world's most renowned ballet companies. Those are examples and expressions of Jing. People come in as old souls. You can just identify something essential and immutable in them. That life energy, sort of like the Energizer Bunny batteries that are on the Energizer Bunny's back. Those kidneys hold your life potential and they move you forward through life. The kidneys hold the essence of the life energy of the Jing that moves us through life. This is where we will also see, however, in addition to the essence of self, which requires an element of courage and knowing of oneself and confidence. The kidneys hold the emotion of confidence and knowing of oneself. They also hold the yin emotion of fear. So you can hopefully start to see how these organs express the essence of who you are, express your personality by your function, by how you're functioning and not functioning in life. And if you have pain points that appear at any of these spinal levels, you can start to ask yourself, examine your life. You know, the ancient Eastern philosophies teach us that introspection is a necessary part of the human condition. If we are to do what the Eastern methodologies tell us we are here to do, which is the awakening of consciousness, the realization of self, one must necessarily have a regular practice of introspection, looking at yourself to see what is active in your life narrative that is standing in the way or preventing you from or supporting you in, and you didn't even realize it, the realization of your destiny, the becoming of the essential you, the immutable you that you intuit yourself to be. So working with backshoot points as diagnostic tools can be an invaluable reference for someone who's not a body worker or someone who works with the physical body, a therapist, a life coach. If you know any therapists, if you have a therapist, if you work with a life coach, share this video with them. You may and ask them what they find in their own clients that correlates to this information. Because remember, as I said in the beginning, you will find amongst different and disparate natural medicine practices similar information, all reflecting one another. Because as Chinese medicine says, everything comes from the same source. Everything is qi. Quantum physics is bearing that out. And it has been said throughout all of history and prehistory, it actually is all connected. So let's start to close out now. We're almost at the end. 2 levels below the kidney, 2 levels below bladder 23, at the blue rectangle, you will find the large intestine. And if you look back up at bladder 13, the lung, you will see that the lung and the large intestine are colored the same. That is an indication, direct indication, that the lung and the large intestine are paired organ systems. What is the connection between the lung and the large intestine? I'm going to invite you to go to the YouTube channel. Hopefully I'll have had a video, I've posted a video on the internal, external connections of the Zongfu organs by the time you're watching this video. And if not, just follow the channel, like the channel, subscribe, and you'll get a notice when the video becomes available. But the lung and the large intestine have an internal-external relationship. The large intestine represents our ability to let things go. And when we think about grief, which is the yin emotion of the lung, and integrity, and how much we are encouraged not to show sorrow, not to show sadness, not to grieve, or to be strong, or to hold it together. And when we think about the large intestine's function of being able to release that which no longer serves us, of course, the large intestine is where stool production takes place and where the waste products of the food digestion process are sent, sometimes stored, and then excreted as stool. When one is unable to allow the full flow of one's emotional experience, you can see a physiological symptom of constipation. You may see something like IBS or IBD, where there's pain immediately followed by a bowel movement, or a bowel movement followed by pain, a dysregulation of the large intestine. That too is a sign and a symptom of an inability to hold or to contain or to self-regulate, or an overdeveloped ability to withhold and contain and not self-regulate, but repress and perhaps even depress. Again, more videos on the YouTube channel and workshops on ThisIsDrM.com to give you deeper and more comprehensive information if you'd like to take deeper dives, or if you're a clinician seeking to improve treatment outcomes by adding a new skill set or augmenting the skill set you have. You're already an Eastern medicine practitioner. Let us go to the last two. We are rounding the corner here. The small intestine at UB27, and we're now at the level of the sacrum. If you look at the line of UB27, you'll see that it goes to one of the holes in the sacrum. That's S for sacrum 3. The sacrum typically has 4 holes in it. These are remainders, these are vestiges of when we had tails and the bones of the sacrum were individual vertebrae themselves. Those individual vertebrae over time fused to become the triangular bone that is the sacrum. But the holes in between that remain are the spaces in between the vertebrae that you see in the spinal column above. So you can find bladder 27, the back shoe point of the small intestine, at the level of S3. Now, the small intestine, you'll notice, has the same color, and it looks like the pericardium, the heart, the triple burner, and the small intestine are all the same color, but there is a slight distinction between the colors. The heart and the small intestine are paired organ systems, and the heart relies on the small intestine for discernment. If we look at the physiological function of the small intestine is where the majority, over 80% of the digestive process takes place. Digestion starts in the mouth and then proceeds to the stomach, the duodenum, the jejunum, and then on to the small intestine, where over 80% of the digestive process takes place. In the small intestine, there's a sifting and a sorting. Useful to the body, useful to the self, not useful. Useful, not useful. There's a lot of walks on, walks off for those of you who are old enough to remember any iteration of the Karate Kid, either the original or the remake. There's a lot of yes and no that takes place in the small intestine. Yes, we're going to keep this. No, this is of no use to us. And that is the function of the small intestine psychodynamically as well, in its service of the heart, which is the chief organ of the Chinese medicine organ system, not the brain, but the heart. And the heart, which is itself protected by the pericardium. So the small intestine goes through this walks on, walks off process of discerning that which is useful from that which is of no use to the self. And it then sends the things to which it says no to the large intestine for excretion through the stool, in combination with the toxic offload of the liver. The liver also sends its toxic offload, and toxic from fat-soluble chemicals, some of which are hormones, some of which give us the chemical substance of our feeling and emotional self. All of that gets sent to the large intestine for excretion through the stool. So the small intestine works with the heart to give us the capacity to discern who, where, and what we are in relation to any and everything and everyone around us. So when you're working with someone who has anxiety, who has difficulty following their life path, who has a history of self-abandonment, which again, my specialty is incest, sexual traumas, emotional abandonment, and addiction treatment. It's common. One of the most common features are shame and self-abandonment, an ability to be with oneself, an ability to remember and recognize who one is. That results also in a loss of Jing, which can create chronic back pain. It creates lumbar instability. So as you start to look at what takes place and what's taking place before you, when someone comes into your practice, or if you present yourself to a clinician and you say, this is what's going on with me, give some attention to your inner life. Give some attention to your life narrative, your relationship with yourself throughout the course of your life, and how fulfilled you are or perhaps are not in the living of your own life. That's going to help you be a more informed patient when you speak to your natural medicine clinicians. And you will be, if you're the practitioner listening to this, a more informed service provider, because you then will have a stronger small intestine. You will be able to discern in between the lines, the narrative of what someone is sharing with you, or what gets commonly referred to as a chief complaint or secondary complaint, what the actual story underneath maybe, could be, quite likely is. You'll find over time that as you do this work in this way, you'll develop a great deal more clarity on what someone is presenting to you when they come into your practice. Lastly, here we are arriving at the bladder. The bladder, you'll see, is blue, so is the kidney. That's an easy connection to make. The bladder and the kidney, the urinary bladder, and we've been working on the urinary bladder channel. The urinary bladder and the kidney both express the emotions of fear and express the emotion of confidence. So the yin emotion being fear, the yang emotion being confidence. One of the ways that it becomes easier to understand the emotional correlation between kidney, urinary bladder, and fear versus confidence, particularly fear on the yin side, is the subject or the presentation of urinary incontinence. But urinary incontinence is something that one might think is a problem or a complaint for either the older population because of loss of pelvic floor strength, or postpartum women. It's very common to have urinary dribbling or pelvic floor incontinence, pelvic floor incompetence after delivery because the pelvic floor stretches to accommodate the passage of the baby. But when you're working with someone who has significant profound anxiety or who has some kind of pelvic floor dysfunction, which you may want to investigate as to whether or not there is a component or a history of incest and sexual trauma, you'll start to understand how the kidney and the urinary bladder reflect the emotion of fear. I had a patient who, once we started working together, was able to recall that the urinary incontinence she was experiencing, which she thought was a direct result of an injury, actually started in her early childhood because she was a victim of sexual assault, incest. The perpetrator lived in the house. And she started to recall during our work together that each time she had no problems with urinary incontinence in school, never once had a problem in school. But as soon as she came home, as soon as the car pulled into the driveway, she had urinary urgency and she had to run into the house to void her bladder, lest she urinate on herself, which can be a point of huge embarrassment for a child because potty training teaches us we're not supposed to have these accidents once we pass a certain age. You know, we're big girls and boys now. This is where shame can be a heavy, heavy repressive component in the treatment of developmental traumas, in the treatment of anything psycho-emotional, in the treatment of anything physical, because we have these expectations established in our social constructs that by certain ages, by certain times, we're not supposed to be doing certain things, or we are supposed to be doing certain things. And certainly having a problem with urinary incontinence associated with nervousness and fear can be a significant handicap in one's professional life. If you're a public speaker, if you run a team and you're afraid of speaking to your team, if you are a manager and you have issues establishing and embodying your own position of professional authority, if you're the clinician and you have difficulty speaking with your patients and establishing healthy policies and boundaries, the function of the pericardium again, because of the relationship, and this is where things get into a little bit of deep water, so just hang with me for a second. This is the only really deep one I'm going to drop into our conversation. But because of the relationship between the heart and the kidney, which holds the jing, the life essence, the you are designed to be, your final destination of destiny, and the heart, which holds your knowing of who you are, your ability to know who you are and intuit the you that you were designed to be. When the heart and the kidney have a good relationship and they're in good communication, you're able to comfortably, easily express yourself. But when there's doubt, when there's uncertainty, when there's been gaslighting, when there's been emotional abandonment, and the self has not had an optimal environment in which to establish itself, fear, and when there's legitimate fear, if there's abuse, if there's fear, if there's violence in the home, if there's insecurity of any kind, financial insecurity, housing insecurity, emotional insecurity, physical insecurity, fear then becomes a common element, an underpinning of the mind of the developing child or the developing person. And when anxiety and fear, when the heart and kidney have this disharmony, fear can overwhelm, or the kidney and urinary bladder will express the psycho-emotional disharmony and lose its ability to contain the jing, and you can have urinary incontinence. This is how Chinese medicine explains phenomena that Western clinical medicine has not yet developed the understanding to explain and to treat effectively. So as you go on in your relationship with yourself, and here I'll stop the screen share, as you go on in your relationship with yourself, as someone who's seeking their own healing, seeking to understand things for which perhaps you've not been able to find any explanations in Western clinical medicine, or if you're here as a natural medicine practitioner, whether it's that of Chinese medicine or another natural medicine discipline, welcome. I hope that the information presented here has given you some insight into how you're functioning, into how the people with whom you are working are functioning, how life itself functions, and that you can take this information and apply it first to yourself, then look for it in the world and the relationships around you, and then start to bring it in. If you're a clinician, start to bring it into your work. Now, remember, as a clinician, important to say, this information is not designed to diagnose in the legal sense or treat any particular condition. It is designed here for education purposes only. So if you feel uncertain about the information that you've learned here, you may need to add to your skill set. You may need to confer with other natural medicine clinicians or people who do this level of work. You're certainly always welcome to message me. I love having these conversations. And I encourage you, as you digest this information, as you process it with the chi function of the spleen and stomach, that you give yourself an opportunity to really integrate and metabolize this understanding, so that when you do go to work with someone or when you do go to work with yourself, you're able to do so from an informed, settled, comprehensive, clear place. Thank you so much for being here with this video again. This is Dr. M of the website. ThisIsDrM.com and all the social media platforms. This is Dr. M. Doctor is DR with no period. This is DRM. thisisdrm@gmail.com if you want to send me a question. ThisIsDrM.com, the website, the TikTok channel, the Instagram channel, the YouTube channel where you will find longer form, more comprehensive videos, and LinkedIn if you're looking to hire a guest speaker. I love doing this with you. I hope you enjoyed watching it. I look forward to the next time we get to visit with one another, and I wish you continued journeying, learning, and discovery with yourself, with your life, and with the people with whom you share it. Thanks again so much.